Hi, my name is Emily Rhodes. I am applying for the Weber State University DNP program. I think I have to talk really fast to get all this in, so just bear with me if you would, please. Personal attributes. I am happy. I love and care easily. I'm nurturing. I am devoted and loyal, and yeah, I'm a mother, I'm a nurse, I'm a daughter, I'm a sister. So my personal experiences, I got my ADN degree from Weber State at SUU in 2003. Had a really good experience with that. I have worked pre-op, post-op, med-surg tele during the awful nursing shortage, 2003 to 2007 in Nevada. That made me a better nurse. Never take hardworking nurses for granted again, ever. And then I went to oncology. And I've mixed a couple other things in there, school nursing and things like that, but oncology is my love. I love walking this tenuous path with my patients, and I really enjoy that they need me and they trust me and they confide in me and they trust me to be their advocate. And I think that is a huge, we learn about this in nursing school. I'm sure you guys know all about that. But that is one of the biggest things I do, is make sure that my patients get the help and the care that they need in every aspect, spiritually, emotionally, socially, and physically. I just can't say that enough, that it's a whole package. And when I get to work, face mortality with these patients, it's a real honor to me. And I don't want to veer too far from that as I move on. I want to be a nurse with an expanded role. That's what I want to be. I want to be the same nurse with more knowledge and more ability to help my patients. That's what motivates me to want to do my DNP. I want to take everything I've learned and just expand it. So, turn my notes. Okay, who's influenced me? When I had my second baby, I had postpartum depression. And I sat down in my OB's office, thankfully, with Meg Benasuti. She is an FNP who specializes in women's health. And she sat down and she said, "How are you doing?" And she kind of tapped me on the leg, and and the tears just started. And she got a box of tissues and she handed it to me, and she said, "Tell me all about it." And she sat there for probably 45 minutes. That's when I knew how much of a difference. Oh my gosh, I'm not supposed to cry during this. That's when I knew personally how big of a difference a nurse practitioner can make. They care about the whole patient. That makes all the difference for most patients. They don't know it always, but we know it, and that's the important thing. And we can teach them that is one of the biggest things, is that they are completely cared for. My coworkers, obviously, I learned so much from them. And my professors, I had some really key epiphanies in my BSN program. Number one, the book, When the Spirit Catches You and You Fall Down, that changed my life. That was unreal. It really gave me a clear view that we don't know the whole story, and you can't know it by assuming. So, and gerontology. I didn't know I had, age discrimination, but I did after that class, and I have worked so hard to change it. And most of that is just being aware of it. And so super, super pivotal moments in my education and in my practice. But okay, let's go on. How will this help? I think I've kind of answered that. I want to be the same nurse, just more, and be able to take what I know and what I found with my patients and expand it. And, the more education, the more you're able to help. The more experience, the more you're able. And so I really look forward to that. What do I know about a DNP program? It's long, it's difficult, and I know it'll be worth it. It first off focuses clinically, but then there's a huge component of research, and it takes the MSN prepared family nurse practitioner to the next level, where the DNP is super versed in research, and she's able to perform it, she's able to understand it, she's able to facilitate it. Anyway, and it makes for really good policymakers and teachers, and helps with best practices. And anyway, they're really cool. Okay, describe an FNP. An FNP is an advanced practice nurse who has the skill set and the knowledge base to assess, diagnose, and treat everyone across the lifespan. She is able to give acute and long-term care. So all of it. How will this program help me in my goals, both personally and professionally? I want to be a DNP. I can't do it without a program. I want to provide for my children. I'm a single mom. Thankfully, I have the ability to go to school and the support to do it. And I feel like this is an obvious next step for me. I've been a nurse for 17 years, if you count my LPN year. So I am so excited to hopefully get to work with Weber State. I hear nothing but good. And I'm an alumnus, so I really appreciate this opportunity to talk to you. So thank you. Bye-bye.